Welcome to Minding World. Today our topic is about HIV. HIV is a virus that attacks the body's immune system, specifically the CD4 cells, which are crucial for fighting infections. If left untreated, HIV can lead to AIDS, acquired immunodeficiency syndrome, the final stage of HIV infection. Origin of HIV. HIV is believed to have originated from simian immunodeficiency virus, which is found in certain species of monkeys and chimpanzees in Africa. Scientists believe HIV first jumped to humans after hunters in Central Africa killed and ate chimpanzees infected with SIV. The virus mutated inside humans, eventually becoming HIV. The earliest confirmed HIV sample comes from a 1959 blood sample in Congo, country in Central Africa. The first case of AIDS was reported in the United States in 1981. Let's dive into global impact. HIV/AIDS has affected millions worldwide since its discovery in the early 1980s. According to UNAIDS, approximately 1.3 million people were newly infected with HIV in 2023. 39 million people were living with HIV globally in 2023, and 630,000 people died of AIDS-related illnesses in 2023. How HIV is transmitted? Unprotected sexual contact with an infected person, sharing needles or syringes with someone who has HIV, from mother to child during pregnancy, childbirth, or breastfeeding, blood transfusions or organ transplants. Myth busting. HIV cannot be transmitted through casual contact like hugging, shaking hands, or sharing utensils. It is not spread through air, water, or insect bites. Symptoms of HIV: early stage or acute HIV infection, fever, chills, rash, night sweats, muscle aches. Symptoms may appear 2 to 4 weeks after infection and can last for a few weeks. Clinical latency stage or chronic HIV infection. The virus is still active but reproduces at very low levels. People may not experience symptoms but can still transmit the virus. Progression to AIDS. Severe weight loss, chronic diarrhea, prolonged fever, and opportunistic infections. Example, tuberculosis, pneumonia. Types of HIV tests. Rapid antibody tests. Results in 20-30 minutes. Antigen antibody tests. Detects HIV sooner than antibody tests. Nucleic acid tests, NATs for early detection. Testing can be done at clinics, hospitals, community health centers, and at-home testing kits. Treatment and management. Antiretroviral therapy. Antiretroviral therapy is a combination of medications that suppress the virus, allowing people with HIV to live long, healthy lives. It also reduces the risk of transmission to others. Pre-exposure prophylaxis. A daily pill for HIV-negative individuals at high risk of contracting HIV reduces the risk of getting HIV by up to 99% when taken as prescribed. Prevention strategies. Use condoms consistently and correctly. Limit the number of sexual partners. Avoid sharing needles. Pregnant women with HIV should on proper medication to reduce the risk of transmission to their baby. Promote HIV education to reduce stigma and encourage testing. Impact of stigma. Stigma discourages people from getting tested or seeking treatment. It can lead to social isolation and mental health issues. How to combat stigma. Educate yourself and others about HIV. Use respectful language and avoid labeling people as HIV positive or AIDS victims. Support organizations and campaigns that fight HIV stigma. Key points to remember. Window period is the time between HIV infection and when a test can detect the virus, usually 10 to 90 days depending on the test type. Getting tested and starting treatment early can prevent progression to AIDS and reduce the risk of transmission. Many people with HIV do not show symptoms for years, which is why regular testing is crucial. Most common scenario: if you have had unprotected sex or a condom broke with someone whose HIV status is unknown and you're worried about exposure, follow these steps immediately. Act quickly. Consider PEP, post-exposure prophylaxis. PEP is a medication that can reduce the risk of HIV infection if taken within 72 hours, the sooner the better. Where to get it? Visit an emergency room, health clinic, or consult a doctor immediately. Get tested right away. Use 4th-generation HIV tests to detect HIV sooner. Avoid risky behavior until you know your status. Do not donate blood or share needles. Let's note, HIV is a manageable condition with proper treatment and care. Research still continues for a vaccine and potential cures. Let's hope and pray for scientists to discover medicine for complete cure. Together, we can end the HIV epidemic by promoting testing, treatment, and education. Thank you for watching. Like, share, and subscribe to spread awareness and support the cause.